अगर ऐसा ऑप्शन है तो दिस इज
सर भी आ गए स्टार्ट करें
Yeah. Hello, good afternoon, everyone, and welcome to the next session of AIIMS-NAMS Navigate Medico CME program. This time, we have come up with a very important and much needed topic in today's era, since we have been witnessing increased number of stress and suicide in recent times among PG medical students. So, this time we would like to discuss navigate medical CME program. I would like to now request Professor Umesh Kapil sir for the welcome address, please. Professor Umesh Kapil sir.
thank you very much we are most grateful to all the participants who have joined. We are most grateful to Dr. Sareen, who has provided the initiative and the leadership to this particular program of NAMS Navigate. Now, my most sincere thanks to Dr. Rajesh Sagar, my old colleague and always helpful to us. I would just like to say that this is a very important topic which needs to be looked into. A lot of issues have been raised about the stress amongst the medical fraternity, be it the students, be it the residents, senior residents, and the physicians. In fact, I was just going to the International Journal of Psychiatry. There were 358 suicide, which is the last part of the spectrum. There are others, right side and left side, if you look at, it's extreme right part of the spectrum in which 358 colleagues have committed suicide. And the suicidal death is one. Might be that in one is the tip of the iceberg. You have only for one, there might be another 50 hidden sort of cases of psychiatric disorders, mental stress amongst the colleagues. Again, sir, my most sincere welcome to you and all the members for their, and we have a very eminent psychiatrist of the country, Professor Sagar, and we are grateful to you again, sir. With these few remarks, I would request Professor Sareen, who has very kindly joined us, to say a few words about this Navigate program and his experiences with stress amongst the faculty of medical sciences. Please, over to you, Dr. Sareen.
Thank you, Dr. Umesh, and for this introductory and for choosing such an important topic. I'm really impressed, and I'm very grateful to Dr. Sagar, whom I'm seeing after a long time, for coming and to help us out in this program. I can recall my days as a postgraduate, and I know there are expectations from teachers, there are expectations from family, there are expectations from all the other patients that yes, here is a postgraduate coming. So the expectations are high. They all want you to perform well, but you are not prepared. So this is one of the reasons probably, and Dr. Sagar will detail it out, is about the stress. But stress is also a way by which you can perform well. Stress is also a way by which you improve your energy and you get ready for the challenges. But medicine is a very difficult area. Medicine poses new challenges every day. More complicated patients do come. So every day we have to get ready. It's not one day that you do stress management. It's an every day that you, your mindset, and your approach is that yes, I am ready. Therefore, I think this session would be helpful to one and all across the country and maybe even globe. And I would like to thank Dr. Sagar on behalf of the NAMS that this session, and if you have some tips which you can pass on, because this is itself a very challenging, set of environment. Coming to AIIMS means you are somebody, and the teachers in AIIMS also expect that you are somebody. So the best of the best go to AIIMS, and the teachers are amongst the best. The curriculum is also tough. So I think your message, Dr. Sagar, and through NAMS, through our secretary and the team, will go across to the country to many, many aspiring postgraduates or those who are already studying, and it will be a great help. With this, welcome to NAMS AIIMS Navigate program, and over to you, Dr. Jaswant, for taking it further. Thank you.
Thank you, sir. Thank you for your welcome address and your address to the students and participants today. So with this, next, I would like to welcome the most renowned psychiatrist, we would say the esteemed scholar, and a great researcher, also a great policymaker in the field of mental health. Now, I would like to introduce, however, I feel that sir is such a big personality and such a renowned personality that he doesn't require formal introduction. But I would like to introduce sir, and this introduction is just a brief, and the achievement of Professor Rajesh Sagar sir is very huge. Like if we see his CV on the website of AIIMS, that's the longest CV I have ever seen in my life. So, sir is currently professor in the Department of Psychiatry at AIIMS, New Delhi. Interest in the field of epidemiology and community psychiatry. Sir also has a very special interest in child and adolescent psychiatry, licensed psychiatry, public mental health. He has more than 700 publications. And if we see on research, sir has more than 1 lakh citation, and that is very significant in itself. Sir has more than 165 research projects. Sir has been a member of, sir has been a fellow of National Academy of Medical Sciences, fellow of International Medical Sciences Academy. He is fellow of International Indian Psychiatric Society, fellow of Indian Association of Social Psychiatry, fellow of Royal College of Physicians, fellow of Indian Association of Child and Adolescent Mental Health. He is also honorary Doctor of Philosophy. He has numerous awards and honors in his name. He has been awarded with ICMR Award, AIIMS Research Award, Indian Psychiatric Society Award, Distinguished Alumnus Award, All India Children's Champion Award, Outstanding Researcher Award as country's topmost researcher in psychology and mental health based on research output in SCOPUS. His name was listed in the world's top 2% scientist ranking by the Stanford University publication. Honorary visiting professor of University of Leicester in UK. He is also honorary visiting professor in University of Melbourne, Australia. And there is also a proud moment that all of we can witness that today itself it has been declared that he will be receiving award for international contribution in the coming International Association of Child and Adolescent Psychiatry Conference in Rio. His other achievements are around 1.2 lakh citations of his research, his high H index of 86. He has been expert and advisory member of several organizations, including expert member of various national task force, Ministry of Health and Family Welfare, member of Governing Council and Scientific Advisory Board of of ICMR. Additionally, he is working as a member Central Mental Health Authority. And for all of us, we are privileged to share that Sir has been the key person in formulating the Mental Health Care Act, which is we can say revolution in modern times in the field of mental health. Sir has been the key person involved in bringing Mental Health Care Act to the people of India. So with these words, I would like to welcome Professor Rajesh Sagar, sir, and it's honor and privilege to hear to you, sir. Over to you, sir, Professor Sagar.
Good afternoon to everyone. And first of all, my thanks to National Academy of Medical Science, and my sincere gratitude and thanks to Professor Sareen, Professor Umesh Kapil, Professor Dr. Sood,
Dr.
and
Susar,
all who have joined here, and all the faculty members of NAMS, and for this wonderful program, AIIMS-NAMS Navigate program. And I can tell you, I am so much delighted to be here. Not only that, but also to choose a very, very important topic on psychiatry, and so that I can talk to you and I can share my thoughts, and which is a very important area. As such, you will know at the end of the lecture that how important it is to understand the stress, and amongst PG students and even medical professional as such. We keep talking about it, but it is important to know the scientific basis of it, know more in depth, so that it can benefit our students and even medical professionals. So with this, I think I will have my presentation. Then later I can take up the question answer session. Okay, so may I request if you can just mute your, so that others are not disturbed, so that yeah. Right. It's being moved only. Okay. Yes, sir.
Sir, arrow key, sir.
नहीं हो रहा ना?
Where? Arrow key, sir.
अच्छा, nice. Okay, so this will be the outline. We'll talk about what the stress is, understand what the stress we mean by that, and stress among medical students or medical professional. I will talk. And also it is important to talk about COVID-19, because that really changed the whole situation as such, and a lot of talk was there on stress of healthcare workers, professionals, and so on. So just briefly talk about it, and we can't take away the COVID which happened, and also talk that how to identify the sign and symptoms of stress. And we keep talking about burnout. So what we mean by burnout, and a lot of strategies I will discuss at the towards the second part of the presentation, that is management, how you can manage yourself the stress situation. So this will be the outline of the presentation. Now, just to tell you, I think Dr. Umesh Kapil already have mentioned it's such an important topic. A lot of discussions has been there. And also, let me tell you, a lot of papers have been published internationally, not only internationally, but also in our own country about burnout, stress, psychological well-being. And you know that well-being and stress are all interrelated. And so in the medical students, so other than what he talked about the suicide part, so you can imagine that a lot of discussion has been there, and that becomes the prelude, in the sense that why such topic discussion on stress is important. And we all know, I always say no health without mental health. So whenever we are talking of health, we need to also take into account the mental health component, the psychological component, because it is the integral part of the in the definition of health. So now let us just understand what the stress is. I think it's like a tug of war, demands and resources. So when the demands are more than resources, that is one way of understanding a stress. So and basically it is a emotional and physical response what one experiences, and more importantly, it is a imbalance which happens between the demands and the resources. So there are multiple definitions, but it's a simple way to define what the stress is. Now I will just give you some example to understand that so just imagine a bench where one person is there, and just see what happens. Then the see the file or the work which is there on this bench, taking the load. Bench is your, and you just go on, and this is the relationship which we all have, which also is there in your in the plate. Then the time factor, the time management, because you have to accomplish the work. Then the about the money and the finances, which happens to all of us. Then of course more work, more files and so on. And then what happens? Then after some time, when there is a problem in the relationship, or there are problems in the in the money or finances, then you can see that the plate which was the bench which was there, it is trying to break up, it's trying to bend now. And so this is like what is the what we call as a stress, like weight on the bridge which is there. It's a source of stress which acts in a same manner the way to our body and mind as such. And also it may continue to bend and strain after some threshold, and so after some time it may break also. You can see it can break also. So this is what the stress is, because when the demands are more than resources, and so you can a simple way understand the concept of the stress as such. Now we will just talk about certain definitions, some simple way that the acute stress is basically what we call as a fight or flight response. Like it is something like our whenever we are encountered with a stress situation, so our body prepares ourselves, the adrenaline rush is there to run away from the situation, so that's, or even to fight for a survival, so the fight or flight response. But at the same time, we know that all the time we can't do it. I always give example: if you are an interview board, you can't fight with your person who's taking interview. You have to face it, you have to be there. So it's basically acute stress is when your body prepares to defend itself. Then the chronic stress is it's a daily living, what happens on day-to-day basis, like your travel, your office files, or even your if you're a doctor seeing patients, and your classes and so on. So when it is left uncontrolled, then it affects your health, like your body or even your immune system. So this is what is the chronic stress. Of course there are other types, but here it is important just to know what is acute stress and chronic stress. And we could hear that Dr. Sareen was talking about some stress is needed, some stress is, and always I feel that is needed, that is important, and that is what we call as a use stress. So stress in a daily life, that has a positive connotation. And of course there is also distress, we know de-stress, that is the stress in a daily life that has a negative connotation. The positive one is a use stress, and the negative connotation is the distress. And you can see it's like a graph. You can see initial phase, there is a calmness is there, and there is an optimum level of stress is needed to the performance. You can see in the y-axis the performance is there, and where that is there. But if the level of stress continues, which is in y-axis, then the distress will happen. It's like this. So for optimum performance, you need some level of stress is important, which we all are aware of. Now this is also important, that the question is that is stress always? The answer is no. And the most important thing is, if you have a life, if you have a stress. Hence the father of stress, was he called the only the person without stress is the dead person. So when you are alive, then obviously you will go through different types of stress. and moderate level of stress actually improves your performance and efficiency, because that acts as a motivation, that acts as a force to reckon with, to come out with a situation. And sometimes people, they do perform better in optimum level of stress. I'm not talking of the excessive, but some level of stress they do perform. Sometimes they say, I need to be somewhat stressful to have my optimum performance. So always think that some level of stress is important, is not always bad. And it is always needed for survival, as already I have mentioned, fight or flight response. So basically the curve is inverted U-shaped curve. Now, the important thing is that we know about stress, but the questions here are, there are three important questions. When is stress experienced as bad? Because we do talk a lot about, so what is that thin line? What is there to call a stress as it's really bad? Then also we need to know why same stressor different reactions in different people, because the stress is same, but it evokes a different reaction in different people, and so again, that's very important. Also, it is also important to know that different people are affected to varying degree with the same level of stress. I will give you example. Let's say a severe stress happened in the form of earthquake. Then not all people will have a problem. Only few will have a problem. Only 5 to 10%, 20% will have some problem, but others will not have a problem. So the stress is same to everyone, but different people are affected in a different way. Or with the same level of stress, people may have a different reactions in different people. So what is important? It is not the intensity of stress. The more important is the perception of a stress. So the perception plays a major role when we talk of stress. The role of perception actually is very important when we, and this, all these three questions actually are answered by the important thing about the perception. And that is what we call as a perceived stress. In fact, there are different scales which are there, which are talks about the perceived stress, not the intensity of stress. Such. Now, just to tell you, giving just example, if you have a glass which is half filled with water, if you ask different people, they will have a different response, half full or half empty. If, and again, some of the psychologists, our colleagues, they say that, okay, those who have said half empty, they are the one who are a bit pessimistic. Those who say half full, they are the one who are optimist, and so on. But the point here is a perception. Same thing is there, same amount of water is there, same glass is there, but different people are giving different responses. So what is important at times, the way in which an event is perceived, that leads to stress rather than the event per se. So that again is important. So giving an example, for some when we talk of student, for some taking the academic program may be more stressful as compared to others. For some, the exams may be more stressful as compared to others. For some, dealing with difficult patient may be more stressful as compared to others. So what it means is that's your own perception at times, which is more important rather than the stress per se. So the important thing here is that the perceived stress is often more important than the actual stressor. So that is what the message I want to give here, that the perception or the perceived stress is more important than the actual stress per se. Now, we'll just talk about what are the stress among medical students or the medical professionals. Just briefly, we'll just talk about and what are the kind of stress and how you can identify yourself. That is why I have put up this message. Now, one is the most important, the job what you are in. Let's say a resident doctor or even some junior level of doctor. So of course, the important thing we all know about it, the workload, time pressure, administrative duties, sleep deprivation, no regular meals. We all know that those who are in the OT and all, threat of malpractice and so on, those, fear which are there. Then there are certain level of stress which is there due to the organizational level, like career structure, what will happen after this PG, where I will go and so on, career uncertainties which are there, inadequacies of resources and staff, lack of senior support, culture and a climate of the organization as a whole. Then there are factors which are related to the doctor per se, that is the personality, what kind of person you are. You are a tough person or non-tough person, or high demands you put on yourself, you are perfectionist and so on, high achiever as compared to others. dealing with death and dying, because there are some specialty where it's more frequent, like deaths. Sometimes they do, because I can tell you sometimes it's difficult to deal with deaths patient in repeated frequent basis, and so on, and confrontation with the emotional and physical suffering as such, because we know whenever we are dealing with this stress emotional component as a doctor, we all there are few who feel so stressful because of this. Then relationship with the other people, if you are working as a team, so staff conflict, professional isolation, patient's expectation and demands, level of support from friends and family, so these all act as an important factor with regard to relationship with other people. Then of course the important other thing, work life balance, I think, which we talk so often, that is stress related to your work and home, your family, your then again issues related to lack of exercise and other leisure activity, lack of free time, home demand, disruption to social life, and so on. So these are some of the common stressors which happen in the medical professional, just to make you aware. And I'm sure you all will know, some may go to some level, some degree, some so we have a different levels of these kinds of stress. Now, this is something important which Dr. Umesh Kapil already had mentioned. I have put up in the slide to talk about that if you see the 358 suicide with, and the data was collected for the doctors, medical student, resident, and physicians between 2010 and 19, 10-year data. And not only this, there were more than 1,000 students who have dropped out of a medical college. I think that is also very, very crucial. It is not just a suicide, but also students who have dropped out with all the things they have been entered. And but you can see that's also a very, very important factor, that more than 1,000 students had to dropped out from the medical college. And you can see that 28% of them were medical students, about 23% resident, 28% physicians, and so on. So you can see such a huge number overall. And that is why it is important that we need to talk about stress, we need to discuss about stress. Then only people will understand, and they will help themselves. This is also just to tell you during the COVID time what happened. These are American data, but CDC data, but just to give you the glimpse of that. Like, more than 60,000 as the US had COVID, 300 of them had died. Then estimated 300 to 400 had died by suicide every year. Just see the number as such. And you can see the 50% had shown a sign of depression during the COVID outbreak, and 45% had shown signs of anxiety. So see the number which happened, and such a huge magnitude which was there. And in our own country, you can see that a lot of discussions were there during COVID time. The stress had increased, and a lot of discussions were there around, and a lot of efforts were made to how to deal with stress in the doctors and healthcare worker, because of the situation which happened. Like lack of knowledge, lack of awareness. No, there was physical call initially. And so on. So all media portrayal, lack of resources, all these were there initially. But also, let me tell you, even the COVID has gone, but some after effects are there. They do talk about the stress which happened. Sometimes there are people who remember those and they get anxious. And even there is long COVID symptom. When we talk, many of them actually have the behavioral or psychological symptoms, like problem with the sleep, problems with concentration, brain fog, and so all those symptoms, we do get some complaints even when COVID has gone. But the effects, when they remember, they do have flashbacks at time when they have faced the torrid time as such. And also the deaths which happened such a in the family, because always in fact we reviewed, and we used to say hardly there would be any family where the deaths have not taken place. So that the amount of stress which our medical professional have faced, that was tremendous. And fortunately, we did have some resources that people were able to cope, but there were many who were not able to. So that is why the importance of stress is there, and that is why we need to discuss more. So even after the COVID phase. Now, this is just to give you the kind of understanding of when we talk of stress, there is something known as demand versus control model. That is also important for the doctor's well-being, which is important. the balance which happens, like balance of the demands like workload, time pressure, emotional stress versus a control as such. Control like decision authority, skill variety, or the autonomy which is there, which actually leads to their own well-being. So if you see the lower right hand side, that is a high strain. When the demands are high, the x-axis, you see the higher side is a right side, and even then the control is less. So demands are high, the control is less. That gives up situation of high stress, which again gives rise to risk of psychological strain and the physical illness. Like this is something when we say the demands are high and control are low. Control low means like there may be emergency where you can't say no to the duty, or there may be some situation where you can't avoid your, in spite of you may not be feeling well, but you'll have to do a duty and so on. So there is no control as such. But when the demands are high and control is also there, that means you have the active learning, the motivation is there. So the important thing is the high strain is there, when demands are high and the control is low. Now, these are some of the common stressors, I think, which we all are aware of, like, personal changes, illness, relationship issues, especially young people, are so important and crucial. Financial problems, family changes, marriage, divorce. Of course, there are some resident doctors who are married, children, death in the family, moving out, work changes, your new boss, job as such, unemployment, environmental changes. So all these are the common types. Of course, the list is endless, but these are the common types of stress which may be there. Now, when we talk of causes of stress, so obviously there in two types it can be described, like the external and internal. Now, external, of course, are environmental, like what we are around, like something like climate, where, it's conducive or not conducive, and so on. The physical surrounding as such. Sometimes there are extremes of, temperature and so on. There are difficult, environment is there. Family and relationship problems which can be there, which again is very, very important, because man is a social being. So the family and the social context and the relationship issues can be so important. Even for the attempt of suicide, they become very important. Even as per the NCRB data, the relationship problems, relationship breakup, they play a major role with regard to stress, more so in a young people. Work-related stress, we all know, overload, social stressors which are there, like financial constraint, major life changes or events which happens, or hassles and demands which are there. So these are all external causes of stress. Now, internal causes are uncertainties or worries which happen. This can be related to anything, your career, your children, your family, or anything. Pessimistic attitude overall. There are kind of people who are pessimistic. They feel that nothing can happen. Some kind of negativity which is there. Self-criticism, unrealistic expectation or belief. As a perfectionist, again, the people who are perfectionists actually can have more stress because they are able to cope with the situation. Low self-esteem, excessive or unexpressed anger, or lack of assertiveness. So these are all internal causes of stress. Now, this is just to explain about what I call as a pressure cooker model to understand stress, anger, or emotion. Now, here, if you see a pressure cooker, if you see one, there is at the bottom, there is a match spark, or what we call an external trigger. I will explain that later. Then there is a flame which is there. Then you can see the content of a cooker, that is unresolved difficulties. Then you can see there is a outlet, the steam release which is there, and the lid which is there at the top. Okay, so just understand this. Now match spark or the external trigger could be anything, and you can see in the left side, like argument, any relationship breakdown, physical illness, exams, poor sleep. So these all can act as a external trigger. This can, like a match spark, it can act. That can be a starting point. Now the flame which are coming, you can see in the bottom. This is about the situation. Now these are basically thoughts which are there, which are coming to you, like thoughts like they are trying to make me look stupid, or I can't do this anyway, so why try this? So these are the thoughts as such. Then the content of cooker, you can see unresolved difficulty. Like many unresolved issues are there, and people like unresolved issues related to your friend, related to your career, related to anything which can be there, which is basically a content, because that also give rise to the stressful situation. So the important is this on the top right side, you can see the steam release. That is basically outlet. So what to do when you are having a physical tension? So basically, what it means, the relaxation. So that's a kind of outlet. That is all your therapists or your counselors or even your mental health professional do. Basically, always advise that is the outlet you need to have. That is relaxation, exercise, sports, even bath, and so on. So all these are kind of an outlet which is there as steam release, and that is what is done as a to elevate, to reduce your stress situation. Now the lid can be tight lid, or can be loose lid. So it's the way how you express your feelings. Now it is something like whether you talk through your things as such, write down your things, or you sing or joke and so on. So that's about the lid, basically how tight that is. So that's your lid. So this is what is pressure cooker model of a stress, anger, or emotion. So because all are related, stress, anger, and emotion. So that's why I wanted this particular example. Now, how to identify? In fact, I can tell you it's very easy to identify that if you are in a chronic stress or not. And what are the symptoms of a chronic stress? Now, it can be divided in 6 major categories, and this is just a list of symptoms. Like, the major ones are physical symptoms, autonomic symptoms, and social symptoms. Now, physical symptom could be fatigue, exhaustion, headache, body aches, different types of body ache. Again, I am repeating because this may be commonly they report to us that they have different body aches, and yourself know when you are stressful, you have body aches or headache. Headache is one of the common symptom. Disturbed sleep, again, it's a very, very common symptom of stress. When you are stressful, you have a difficulty in sleeping. Nightmares, early morning awakening, appetite changes, and so on. Then autonomic symptoms, which again are symptoms of stress. That is dry mouth, heart palpitation, chest pain, abdomen cramps, trembling, and so on. So these again are the symptom of anxiety also, because as I said, stress, anxiety, all are related as such. Then the social symptoms could be withdrawing from others, poor interpersonal relationship, few friends, unable to trust on others. So these are 3 major symptoms: physical, autonomic, and social symptom. The other 3 are what we call the behavioral symptoms, like withdrawn from others or excessive dependency, lack of self-care, lack of initiative or procrastination, or other manner issues. Then interpersonal issues or poor productivity, absenteeism, accidents, errors, and so on. Cognitive thinking again could be memory complaints, inability to concentrate, indecisiveness, negative thoughts and distortions, which we'll talk about, loss of objectivity, and so on. Then, of course, there are a whole lot of emotional symptoms like tearfulness, mood swings, irritable. So whenever, that's one of the common symptoms of stress. Anger, impatience, feeling of helplessness, self-critic, pessimistic thoughts, feeling of overwhelm, feeling rushed all the time, loss of sense of humor, excessive worry, restlessness, pacing, fidgeting, sense of ghabrahat, and so on. So these are 6 set of symptoms. So if one is going through this for considerable period of time, then maybe that person is under stress. So it's very easy to diagnose or understand or identify whether you or anyone else are having a stress or not. Now, it is important because we all are working. So there are certain signs of stress in the workplace, like poor decision making. That's again a very, very important symptom of stress. An increase in mistake during work. I can tell you there is a good enough data from I know from US that 75,000 errors were done in the medical professional, that by doctors because they were under stress. So that they have calculated. Just imagine the magnitude, such a huge magnitude. So a lot of mistakes and errors are done that may be because of that you may be under stress. Inattentiveness or poor concentration, increased sickness. A lot of people who are on unexplained leave at times also may be under stress. So that is also one of the soft indicator of that person may be under stress. Poor employee or work relationship, again, that's a very crucial and important. Disinterest in work or any fatigue. So these may be symptom or signs of a stress at a workplace. Now, we briefly just talk about burnout. I think this is a very, very crucial and important concept, and we need to know, and you may be hearing about it. And so basically, burnout is state of emotional, mental, and physical exhaustion caused by excessive and prolonged stress. I think that's a very point to be underlined. That is excessive and prolonged stress, which is there, can lead to this emotional, mental, and physical exhaustion as such. And as the stress continues, so what happens? That is, you loosen the motivation, and which again take a certain role in the first place. And most commonly, it is seen in the people who deal with people like healthcare professional or caregivers of chronic illness. And if you know that the caregiver of people who have a chronic illness, let's say a dementia or even schizophrenia, they are under huge stress, even burnout at times. So these are the certain groups of people who have more tendency, including healthcare workers who are there, can have these burnout symptoms. On the left side, you can see that these are all signs of burnout syndrome: feeling exhausted, falling frequently sick, low mood, weight loss, hypertension, low self-esteem, absenteeism, anxiety, low commitment to work, and so on. Now, it is important to also know important to know that what are the physical and psychological illness due to chronic stress. Now, it's a misconception that they all lead to psychiatric symptom, which is not so. Even if you go to your doctor for your diabetes and hypertension or cardiac illnesses, even skin condition, they will tell you that reduce your stress. I'm sure you all will know. So actually, stress has a bearing not only for psychiatric illness, but also for a physical illness. And there are biological basis to it. So, so if you talk of physical illness, in fact, no body is spared as such, no organ is spared, like headache, sleep problems, anxiety, depression, which is there, high BP, damage to heart attacks, again, irritable bowel syndrome, again, is related to stress, a decreased sperm count, impotence, muscle aches, and decreased immunity as such, menstrual irregularities, diabetes, acne, pimples, asthma. So all these could be so important point to remember here is stress, chronic stress, not only lead to psychiatric symptom, but also physical symptom. They are equally important. That is why it is important if you want to take care of your stomach, irritable bowel, or even heart, or diabetes. So you'll have to reduce the stress. Now, of course, common stress-related disorder, we all know: depression, anxiety, dissatisfaction, then fatigue, aggression, concentration problem. So you can have a symptoms which are a psychiatric symptom like depression, anxiety as such, or even simple things like aggression or fatigue or concentration problem may also be there because of stress. Now, depression, again, just to tell you, it's very easy to diagnose. More than 2 weeks of symptom, having low mood or fatigability or even lack of interest. If it is there, then that's a core symptom. So one can easily diagnose a depression. So stress and depression or anxiety, already I have said, palpitation, sweating, which lasts for a few weeks, that becomes anxiety disorder. So it's very easy to diagnose, because ultimately what happens that those who are under chronic stress can have presentation to psychiatry, the depression, anxiety, along with other disorders. So that way, stress has a one can identify early, so you can make a diagnosis early and treat these conditions very early. Now we're coming now to the the management aspect. That is what we have to understand is the vicious cycle which happens: thought, feelings, behavior, and physical response. Now, thoughts, we all know, thoughts play a major role. I just can't cope with anymore, leading on to feeling that I'm stressed or irritable, which again leading on to behavior, avoidance, or doing too much or doing too little. Like, it also is a kind of behavior. Either you avoid it, or you just want to do too much and ignoring your diet, ignoring your sleep, and so on. which again leading on to a physical problem. So that's physical responses are shaky, being sick, tingling sensation, and so on. So this is all which is important, a vicious cycle which happens. Now, hence, Ale, we know that the father of stress, there is something known as general adaptation syndrome, gas, and basically it's a stress response, how the system defends and fatigues as such. So initially, if you see on the left-hand side, the x-axis, you can see the low and high stress resistance which is there. And the Y, you can see phase 1, 2, and 3. So initial phase is what we call as an alarm reaction as such. Or if you see, actually, there is a honeymoon period at time when the disaster happens. Actually, it goes down a bit. Then the problem comes, and there is a long period of body resistance is there to stress, which can last for long period. Before then, the exhaustion start. Then it is dipping down, where the exhaustion is happening, which is leading on to a lot of multiple problems when the reserves are depleted, when you have illnesses like physical or psychiatric. Okay, so this is some of the, I will tell you some of the studies which I am just highlighting one or two studies which which we did recently on trauma center, those who are working with that, and you can see that 153 staff member which were seen, and you can see such a high level of stress, like 54% of people have reported anxiety and 40% stress and 36% depressive symptoms, which is published in Indian Journal of Critical Care and Medicine. So these all there is evidence to it. It's not just we are talking about it, and this is our own study. And this is something which we published about, I would say, 14 years ago. Stress and suicide among medical students. Time to act. And that is why many suicide which happened and many students which were under stress. But now we know even NMC have recognized the importance of stress. And which we wrote about 14 years ago, where that what needs to be done, the environment, frequent screening, and so a lot of in this paper we have given suggestion that all colleges which can adopt, where stress in our students can be reduced. Okay, so just stress management to talk about again. By now we understand the stress, we know that how to manage it, how to understand, because to manage stress, it is important first to understand the stress. Now, the important thing is that the first step, what we know, is to acknowledge and normalize distress. So what it means is help people gain perspective that is normal to feel overwhelmed during times of stress, that to feel that's a normal, which happens, can happen, it happens to others, it is happening to me also. It is not something very unusual. Discourage any attempt to suppress emotion or distract for them as ignoring distress, because sometimes it's not, we need not suppress it. ये तो कुछ नहीं है, we did not dismiss it. The more important is that we need to acknowledge and validate all their concerns. I think that's very crucial and important. And that is what we give in a way we are providing a support. If we try to dismiss everything, then again the person who is undergoing so much distress will feel इससे क्या फायदा हुआ मेरा, so we need to validate and we need to normalize distress rather than suppressing it. I think that is very crucial and important. Then the most important thing about stress is to encourage the ventilation of emotion. I think that's a very crucial thing. Encourage patient to reconnect with their existing support network, that is family, friends, which again is very crucial. Regularly express them about all their emotion and thoughts. Maintaining a daily journal, also allowing one to engage in the process regularly. Then these are 3 A's of managing stress: simple, awareness, analyze, and apply. There are 3 A's just you have to remember. Awareness, as I said earlier, if you are having a symptom of stress, being aware that I am under stress, or he is under stress. So being aware is a first step, which is very crucial. Sometimes we deny it, we just ignore it, which actually is not a correct thing to do, being aware. Then second is analyze. Okay, just think, okay, why I was stressful? Maybe that, I'm thinking too much about my exam. I'm thinking too much about my thesis. So just analyze, think about it, do the introspection. And the third is, what all the steps you identify, try to apply it, do the action now. Okay, now I will do this, I will be more regular, I will try to face it instead of avoiding, and so on. So awareness, analyze, apply. Now, also there are few tips which are important for management of stress. that stress do not mean that you are weak. I think that's an important message always I try to give. If you are under stress, does not mean that you are weak or you are ill. It is just a phase, like a wave which comes and goes. It's that just means that it's just a phase. That it is not considered. It does not mean that you are weak in any way. Again, we always say the way we take care of your physical health, similarly, we need to take care of your emotional health. Again, that is very, very crucial and important. If we have any injury, what we do? We go to a doctor, we go to a emergency. Similarly, if you have emotional problems, any issue, so why not we just raise your hand and seek a help for that? So it is equally important, if not more, as compared to physical health. Basic needs has to be taken care of, and one can employ coping strategies, which we will talk about. And the most important thing is that people may say many things to you. I know many people under stress. They will say that listen to a music, read a book, or go and watch a movie or whatever. But I will tell you one thing: you know yourself what works best for you. That's like a menu. Like when we go to a restaurant, we get things of a choice. Though there are many things around us. So things which have benefited you in the past will be more likely to help you. Much better than the therapist or the doctor. So you can do that instead of, so you are the best judge of yourself. If your stress worsens or overwhelmed, you are not to be blamed. I think that is also very, very important point. Sometimes we try to blame ourselves, which again is not a good thing, because it's a situation. And of course, there are certain challenges can be there. Like sometimes, you think, नहीं मुझे तो stress हो ही नहीं सकता, मैं अपने आप इससे बाहर आ जाऊंगा. I need not take any help. I need not. So these are some of the challenges which are there, which we need to take care of. Then there are simple strategies, I think, which all we are aware we can do that. Acknowledging that again is very important. Taking care of self. I will talk that more in detail. Distracting oneself from through simple chores and routine activities. Engaging in a physical activity and simple exercise, I think, is very crucial and important. Viewing stress as a normal and obvious reaction to circumstances, again, is important. Communicating with your colleagues and friends and be well informed. Again, these are important things. Then understanding your own limits to manage the crisis. You know that till point you can help yourself, but if it goes beyond, then you have to take help of family or even professional if needed. So you have to know your own limits. Stay connected with your family and friends, and through any means you can be connected. Which again, because staying connected and getting that feeling of connectedness is very crucial, and that acts as a buffer. Actually, it helps you to come over the crisis of stress. Stepping back or a break when needed, again, that's important. Engaging in hobbies or interest, again, that during the COVID time, many people who had come to my clinic, 70-year-old, sometime, I was saying, why not you go have your hobbies? I said, no, they used to laugh at me. I used to play guitar during my young days. Why not you start now? And there are many people, I can tell you, come back to me later, say that, no, doctor, you are right. And that's a kind of satisfaction which that gives. And we tend to forget the importance of all this, and which we can do, and that can be important. Stress buster and stress reliever. Relaxation techniques, breathing exercise, yoga, meditation, again, they are important. Ask for help or support from peer or colleagues. Healthy eating habits, sleep hygiene, avoiding unhealthy method like smoking, drinking. Practice your own method to de-stress. Again, that's crucial and important. And so these are some of the important, and also a team leader, supervisor, also some of them you are in that situation. So that also will be important. Just to briefly talk about PFA, that is a psychological first aid. Again, it's a very, very important concept. Like first aid, we all know there is a first aid. We go to the hospital. It's given by not by a doctor, by anyone. Like you put a bandage and all. So similarly, there is something. The same concept is the psychological first aid. What it means is there are three things which are important. 3 L's: look, listen, and link. So anyone who is in distress, check for safety. Check for people with obvious needs. Check for people with serious distress condition. That is a look. You are looking at a person. That itself may be satisfying. Listen to a person. I think listening is a very, very important skill. I think if you are listening to a person who under stress, I think that will relieve more than 50%, I would say 60% of your problem. And you know yourself, whenever you are under stress, what you want someone to listen, someone to talk. That's why the theme of depression in World Health Day was depression, let's talk. I think that sharing, listening, I think these are the important skill for everyone. And the linking is that you link for basic needs, for the services, you tell, okay, go to this place. So that's a link. So look, listen, and link. Stress management, again, these are important. This acronym: behavior, exercise, relaxation, nutrition, which we have talked about as an acronym, you can remember. And the main point is how you can make changes to your life situation, and how you can practice a self-care and so on in these stressful situations. Now, why stress management is important? Why, how it will help you? It can improve your mood, and there are evidence to it. Boost your immune function, promote longevity. I think there are enough evidence for this also. Improve work performance. I can assure you, and if you take care of, you apply some of these principles, your own performance will increase. Increase your stress tolerance level, strong your coping skills, and facilitate the interpersonal relationship. So these are all benefits which can be there with a good stress management regime if you apply. And these are the things you know by now, that eating habits, regular sleep hygiene, thinking positive, and so on. But what more? There are three things which are again important. I'll just tell you: cognitive techniques, emotional techniques, and behavior technique. Cognitive techniques are means is a thinking type of technique, like identifying and reframing, positive self-talk. Then emotional technique: ventilation, sharing, building up daily positive emotion, relaxation exercises. Then behavioral technique: time management, organization skill. I've just briefly talk about what are these. Basically, what it means that cognitive means, if you are in any situation leading on to your internal thought process, again, which again leading on to the emotions. So that's how the whole this cycle is there. So what we how we feel actually dependent on your thinking process. If you are thinking, if you are angry at someone, then you will feel that something bad will happen, something, so that kind of thinking process is there. Thinking and emotions are related, and along with your internal thought process. So basically, there is something important technique, psychological technique, what we call as a reframing. What it means is that is not changing the stress per se, but the way you think about stress, that you change yourself. And that is what we call as a cognitive error, cognitive distortion. Forget about this technical term, but I will tell you how you can do it, reframing. The situation may come, you may think that I can't handle this, but you can say yourself, you can reframe it. This is hard, but my support system will help me. The situation may come, I'm not good at this. If any work has been assigned to you, you can say it's okay to be work, but it can be work in progress. It is a process. I'm learning all this. I don't have many friends, but I will continue to make friends throughout my life, and so on. So this is a reframing you are doing. This is a change in the thinking process you are doing. That is what is known as reframing or cognitive reframing. Now, there are certain thoughts which are there again in the context of the same reframing, like I never do anything right. Sometimes these cognitive distortions can happen, overgeneralization can happen. Because my boss, my teacher, my consultant has always said that I can never do anything right. So what the rational thought could be concomitant, what you can do. There may be many reasons behind this poor performance today, but I will try better next time. So just you have to change your thinking process. Everyone must be thinking, I am so bad, So these type of thoughts, I'm sure all of us have these, when you are stressed up, then you can say to yourself, you can reframe it. Since we cannot read others' mind, let us not assume that others must be thinking in that way. So these are, some of the reframing you can do, which can reduce your stress per se. Now, there is another very positive thing. Always I tell self-talk, positive self-talk. Like sometimes we say to pat yourself back, whenever you have done good. It's a positive language and statement which we do to ourselves. Now, what it means, for example, I can do this. I understand this. I will try my best. These work best when they are realistic, tailored to your needs and the goals. So sometimes they do work, and there are a whole lot of situations. I am enough. I believe in myself and my ability. I can control my own happiness. Today I am a leader. Today is going to be an awesome day. I can get through this, difficult situation. So these positive self-talk can be very beneficial. Sometimes when we get a message, okay, have a great day today. So it gives a good feeling at times. So positive self-talk again is a very important skill, and you don't need anyone to do it. You don't need any therapist to do it. It is your own self. You can do it on your own. So that is positive self-talk. Then there are certain emotional technique. I think just to give you the cycle, emotions play a major role. Like there is a whole concept of emotional, competence. When we talk, then in emotional competence, we have something known as self-awareness, emotion regulation, social awareness, and the relationship issue. So emotional regulation is very key and important. So is the cycle is like notice how you feel. That's a first step. The second is name it. Name the emotion. If you're feeling angry, okay, name it that I'm feeling angry. So just name it. That may help you. Accept the emotion. Acceptance again is a key thing. Then investigate as such. Investigate how intense it is, how severe it is, and so on. Then look for the release and the remedy for it. How you are going to relieve from this stressful situation. So these are certain the emotional regulation techniques. Then important is the ventilation. We all know it's a common saying in Hindi, तकलीफ बांटने से कम होती है छुपाने से नहीं. So when we share it, actually you will help yourself. Develop a social network through your family, friends play a major role, and talk all about your emotions. I think again that's important. You know yourself when you share it, आपके मन से बोझ हट जाता है. You feel like when you have shared, you feel relieved. You feel in a way very calm after that. It's not the event always which are stressful, but how we perceive that is important. So sometimes we do tell in our clinic to maintain a journal, to write your thoughts, write your difficult situation, and so on. Express yourself. It's a type of ventilation. Building up the positive emotion, that again it's a very important thing which you can do yourself. Engage in activities like positive, which evokes a positive emotion in you. Keeping up your hobbies, and simple thing like listening to music, going to park, or anything which you like. Find your time every day. Have a time, at least 15 minutes, 20 minutes, half an hour for yourself, which again will give rise to your positive emotions. Now there are a lot of relaxation techniques which are there, and like breathing techniques which are there, and which are very easy to do. Progressive muscle relaxation, again you tense and relax your muscle one by one, which again is one can easily do, and there is evidence that it gives a feeling of relaxation. Use imagery or visualization, again that's like imagine yourself in a pleasant or successful situation to help to reduce your stress, like you are in a beach, you are in a garden. Think about it. That also or imagery also gives a feeling of relaxation. Now there is a lot of talk nowadays about mindfulness. Mindfulness is again not a very technical, it's basically how you are being aware of yourself. And so there are two things which are important: attention and acceptance. Like what it's a here and now. You are living in the present. You are just trying to like feel your breathe and your muscle tension, feeling around you what is happening. So that is what is being mindfulness. And there are mindfulness meditation again, which again there are few steps which can be done, which are easily one can do it to gives a feeling of relaxation. Again, they are all there, 5 minutes video, 3 minutes video, which are there in the YouTube, you can see. So basically the whole idea is that just you feel your let's say your breathe and the sensation which are flowing through your nostrils and your mouth, and just you see that you being aware of your sound sensation and your ideas and so on. So that's what is mindfulness meditation. Now there are few behavioral techniques. Again, the most important, I think I have seen that many people have a difficulty with regard to time management, and some say that because of I'm not able to manage time, so I have a lot of difficulty, I feel stress. Now it's very important that we can keep ourselves organized. and help us manage the daily schedules and effortlessly, I think you can make a diary and reduce the work related stress and hurry. We need, sometimes we always are in hurry, we are not meeting up the deadline. So that is important, that we need to organize ourselves, because this is one part which gives up a lot of stress to us, because we are always hard pressed for the time, we have many deadlines. So it is important that how we are able to have a proper time management skills again, which is very very simple and you can do it. Now you should also know what your time wasters are, because that again will help you in managing your time. Not setting a priority or planning effectively, drop in visitor interruption, which can happen many times, procrastination, inability to say no, disorganization, too much socialization, not valuing the time, lack of skill. So these are some of the time waster. Each person may have a different types of time wasting techniques. So one should be aware of it. Once you are aware, you can control about it and you can have a better time management. Then organization skill is important, because all of us in the time we are it gives a lot of stress. So just you can see this four quadrant as such, and you can see the left side, that is, one is on the importance, the other is urgency, that how early you can do, and the importance, whether it's high or low, urgency high or low. Now the most important number one you can see, which is urgent as well as or important, when which is both, then you have to do it now. But there are certain things which are which may be urgent, you have to do it now, but not that important, so you may delegate it to someone else. Then the number two, you can see the important but not urgent, then decide when to do it. You can decide when to do it, you can mark it in your diary that when I will do this. And the number three, you can see not important, not urgent, then dump it, you don't think about it. So these are some of the things you can do it yourself, so to manage your time. So there are certain few more techniques. Now this is very important, always I try to mention, that is self gratification. Now what is important, what matters most is how you see yourself. I think that is a very key thing. And there are many scientific studies have shown the importance of realistic self reinforcement. That is, meaning recognizing the positive in us instead of seeing only the negative. Sometimes what happens, we have become so critical of ourselves. We become so critical. We see only negative side of it. But at the same time, we need to see a positive in ourselves. The self reinforcement again is very, very important, and very self gratification is one of the key aspect on this. So how it helps? It can increase the motivation, and it decreases the tension, and it helps to have a feeling of inner security as such. So self gratification is a very it looks very small, but it's very very important, because ultimately it all depends that how you see yourself, how you are able to motivate yourself in such situation. Even in the event of adversity, if you are able to do it, then you can overcome even some of the difficult situations. Now, a lot of talk is there, work-life balance. I think many of our resident doctors who are there, they said our work-life balance is disturbed. And so we have to maintain a very healthy work-life balance. I think we are able to, because sometimes work affects our life, life affects our work. So we need to see that how we are able to enjoy both in a balanced way. I think, and there are many sessions on this. One can have a whole discussion on this aspect alone. Now, it is important, I think, having said all this, what we need to do, there will be a time where we need to consult a mental health professional in case of high level of distress. We can't forget this point. In spite of all the difficulties, we need to see that when to consult a mental health professional, because ultimately there is a limit to things, So we should not deny the help. So it is important that if a time has come, if it has crossed the threshold, then we need to see that we need to consult a mental health professional, which medications can be provided, counseling, there are different kinds of therapy, yoga, meditation, all these can help in a person who has under stress. So these are few self-help strategies which one can do. And these are all already we have discussed that: maintaining healthy lifestyle, having a support system, scheduling a vacation, structure a routine. This is just to summarize now. Gratitude journaling, making a relaxation routine, practice what already helps you, seeks out specific mental health support, and so on. So these are important self-care techniques one can employ. Then these are some of the worksheet you may not be able to see, but in a self-care assessment, like a physical self-care can be there, like eating healthy food, taking care of personal hygiene, exercise, eating regularly, and so on. Physical, then spiritual self-care like meditation, praying, and other things like this, spiritual self-care. Then there is a professional self-care, like improving the professional skills, saying no to excessive new responsibility, taking on new projects and so on, learning new things, taking break during work and so on. Then self-care assessment with regard to psychological and emotional care, that is taking time off, participation in hobbies, which already we have discussed, get away from distractions and so on, expressing a feeling, going on vacation and so on. Then social self-care, that is spending time with people who I like, and whole lot of things which are related to social self-care. So one can take, you can assess yourself in these, in a different domains, that is a physical, spiritual, professional, psychological, and social self-care. Now it's very easy, like say for example, in this way, these are last two slides I have. Then you can write it down, identify your own stressor and the way of coping, like see on left side, that is stressors. Like you have to do a planning for the busy weekend ahead, like you have multiple assignment in the week and the Sunday night you're sitting, so that can be one stressor. Now what could be a reaction of this stressor? Like sleep deprivation, it may lead to sleep deprivation, or you may be restless, or you may be anxious, so that's a reaction to a stressor. Now, what is a coping strategy you can do? You can adopt. I'm just giving you one example. Make a list of it, follow the relaxation routine, plan the activities ahead in a proper way. So these are the coping method which can be employed in this situation. So this is how you can identify your stressor and also the coping strategy. Okay, so this is the last slide. That is the take-home message. Stress is universal, we know. Different people react differently to different similar situations. Stress is about perception. One can learn healthy ways of coping and stress management. Prioritizing self-care by maintaining a balance between academic demands and personal well-being. Then seeking support from peers, mentors, mental health professionals when feeling overwhelmed. Then manage your time effectively to minimize stress and maximize productivity. Develop healthy coping strategies to navigate challenges and maintain resilience. Then last point is keep a perspective on a bigger picture, remembering that your well-being is paramount on the path to become a successful healthcare professional. So these are some of the important take-home message and the conclusion of this particular seminar. Thank you so much. I just want to read out this. Grant me the courage to change the things I can change, the serenity to accept those that I cannot change, and the wisdom to know the difference. I think that is what the whole management is stress about, all about. Thank you so much. And thank you once again to NAMS and all, Dr. Umesh Kapil, Dr. Shiv Sarin, and Dr. Sood, and all those who are here. And thank you for the opportunity. I know that I have slightly taken longer time, but I was so engrossed, so I couldn't stop myself. Thank you so much. Thank you. Back to you, Dr. Kapil.
Thank you very much, all the participants. A lot of people have asked for the PowerPoint presentation and the YouTube link. I can assure you that by 6 o'clock, the entire video of the presentation would be available on the NAMS website, and all the PowerPoints also. That is what's the rule, what we are following, that each of these please just bear with us. And there are about 28, 29 questions. So we'll take up each question with sir. And it's a wonderful lecture, I would say. But still, everybody knows about it, that I am stressed. How to come out of it, how to manage it is a big issue. And it's not only with doctors, it's everybody. They know it, what to be done, but they're unable to do it. Everybody knows deep breathing is good. Everybody knows muscle relaxation is good. Reciting Om is good. But then they're unable to do it. And some of them are able to manage it well, sir. But there's no doubt about it. Thank you very much, Dr. Sagar. We can have the questions, please. Ravi, can we have interactive questions? Yeah. So, yeah, please tell your name and
என்ன சொல்லுவாங்க நிஜமாவா மீனா மேம் சொல்லுவாங்க யாரையோ தான் நீ கொடுப்பா உனக்கு ஃபேமிலி கம்ப்ளீட் ஆயிடுச்சுன்னா நீ கொடு
Ravi, questions though. Dr. Jaswant, you can take up the questions, please.
Dr. Jaswant, sir. मैं चैट ऑन कर दूं?
तो सब क्वेश्चन पढ़ते जाओ वहां से।
नहीं, मैंने नहीं, फिर वो अपने आप उधर से आ जाएगा।
इसको बड़ा
डॉक्टर जसवंत सर, वो वहां पे है नहीं।
Hello, sir. Am I audible now?
Yeah, you can ask question, please. You can
Yes,
tell
sir.
your name
I
and speak
asked,
loudly.
Yes, sir. Doctor.
हाँ,
Yes, sir. Dr. Aditya Mahota asked a question that, sir, would you please recommend self-help resources to aid in stress management? Thank you.
सब तारीफ में लिखा हुआ है। अच्छा
अच्छा ठीक है।
Thank you for this session. Thank you very much. Lovely talk. Thanks, sir.
Yeah, you can identify yourself, raise your hand, and then speak loudly, please.
Hello, am I
Yeah,
audible,
please.
sir?
Yeah, you are audible. Please go ahead.
I am Professor Selvakumar, sir, from Tanjavur
Yeah.
Medical College. I have got a question to the learned speaker, sir. That is, as a professor, when I find postgraduate is having issues regarding his mental issues, mental health
Yes,
issues,
sir. Good
and he is not.
afternoon. May I give suggestion?
Hello.
Please go ahead. Go ahead.
And if he is not
Am I
agreeable to
audible, sir? Myself is
agreeable to take treatment, or like he's not very regular in his treatment, what should be my plan of action, sir?
Okay,
As a
I
professor.
think that's a very, very important and question. Let me tell you this, and this not only you, but faculty or teachers or consultant of different medical colleges, they do face this issue, because after all, when we talk of 10% morbidity, then obviously if a college there are 100 students, obviously 10 will have a problem. That's true. Now, what I think is important is, but the challenge is that mental health conditions are also stigmatizing. I think that we know that there is a challenge. So first of all, my message would be that you'll have to infuse or instill the confidence in any student. One, that it is, you can say that what all you are talking to me is confidential and no one will know it. Like that's what I do in my clinic whenever student comes to me, that no one will ever come to know what we have discussed. It is between you and me. So that infusion of confidence is very important. Number one. Number two, you have to ensure that what all if you can. If you can refer to your psychiatry department, you can talk to the consultant there. That is what we do. Like, we do get a lot of referrals from other department. They talk to us personally, and sometimes it happens that many times they don't go there also, because again, it depends on the kind of a comfort level they have. But we have to keep on trying. We have to see. We sometimes we need to call their parents. We need to talk to their friends, and so all those strategies has to be applied. And because it is a sensitive issue, and you that how seriousness this issue is, but it has to be, the efforts has to be multimodal. Always I say, it is not straightforward. Sometimes there are different ways of doing it. So the important thing is, if one has any mental health issues, then it has to be and identified. It One has to inform about this to a person or even to a family member, and see that all the necessary help can be provided. I think this is what message I can do. And and all of us are doing in that way. And that is why sometimes, if necessary, we may have to admit, but most of the time admission is only tip of the iceberg. That's not required. I would say most of the time only some consultation, some treatment is enough from the OPD basis. Sometimes these students are very reluctant to come to OPD, so you have to talk to them in the office. So different methods have to be employed, because they know if they come to OPD, then if there are others who are watching them, they will make fun of them and so on. So this is a very sensitive issue, has to deal in that way only, and so if the problem is there, then we have to deal it and handle it, and we may have to refer to a psychiatry department. I hope it answers your question.
Thank you. Yeah, thank you, sir. My second question is, am I audible, sir?
Yes.
My second question is, like, off late, like, I'm working in a government medical college. When students from a private medical college, they join, I belong to the Department of Pediatrics. They find, when they find the mortality is higher over here in government institutions, like when they don't encounter deaths in private medical college, they have a sense of guilt, and they go into depression, sir. Like, how to go about it?
Yes, it is a very important point. In fact, I mentioned in the presentation also that somewhere it depends person to person, what kind of person you are. And if there are many deaths are happening, so one takes, at times it can have a negative, effect on us, and because we are not used to it. So my suggestion in such situation would be to, if this is happening, one is feeling disturbed, so one can have a one-to-one talk. Like, you can call, you can discuss, you can see that what the issues are, and if the because what the simple rule is that if they are able to express, ventilate, talk about it, then things may and someone is there to listen to their distress, that will in a way help them. But if a lot of anxiety is there, so one can then one has to see that the treatment proper can be initiated. But important thing is that there would be some student who have a difficulty, because they may feel anxious because of deaths, because of certain even procedures also. Sometimes they are not used to it, or which may affect the whole learning process also. So the best is that the any faculty, because who is there, the person to whom he or she is close, can talk to the doctor, and see that what difficulties are there, and giving a message that we care for you, we are helping you, we are not going to penalize you, and we want to support you, and see that how you can come out with the situation. If that positive note is there, then the more confidence will come. And and sometimes for these difficult situation, we advise, like, A long time back, 20 years ago, I used to take communication skill classes to the resident doctors. So we used to have role plays also. We has to have discussion, interactions, and so all these it helps. The more you talk, the more you discuss, the more you ventilates. So that can relieve their anxiety and the stress related to these conditions.
Thank you, sir. Thank you.
Thank you. My pleasure.
Thank you, sir.
Sir, there are various questions which were asked on the chat box. First from Dr. Aditi Mohta. Sir, would
Just a
you
minute.
please
Which is there in number? Just tell me the time so that I can scroll down.
right, sir. Sir, first
16?
was asked time
का number क्या है?
at around,
Because
so first question at around 3:52.
eh?
Dr. Aditi Mohta. 3:52. 15:52
आवाज
time पे है.
your
Dr.
actually voice is
Aditi
echoing. So आप just मुझे time बता दोगे तो मैं यहाँ देख लेता हूँ.
Mohta.
Your voice is echoing.
3:52.
3:52.
3:52, sir. Yes, sir.
Is it which time?
15:52. Dr. Aditi Mohta.
तो बड़ा
Have we?
question है, sir.
अच्छा, okay. So
So I have said 32, sir.
have you carried out any study about many PG students are requiring psychotherapy and treatment? How many such students avail of psychiatry treatment? Is there a baseline data available and leads to suicide among? Have you carried out?
रवि इसको बड़ा कर सकते हो फॉन्ट को?
ये इसमें नहीं है क्या ये? इसमें
Sir, I have sent to Professor Sood sir के phone में I have sent the questions.
अच्छा, you have sent. अच्छा, okay. 3:52 में. अच्छा, just a minute. 3:52. नहीं, ये तो इससे पहले वाला है, इससे पहले. Okay, so one question, I think what you are saying is, have you carried out any study? There is no such formal study, but I can tell you general. General is that many students, they do have, some of the problems are, they do report to psychiatry OPD or student wellness center. And so there are good number of students, they do get help. And where the therapy sessions are provided, in some, there are even medicines are also provided, and few even they are admitted also. So it can happen everywhere. So if you want the exact number, that I will not be able to tell you. But yes, and it is confidential also. So but we do also, I can tell you at AIIMS, we also have a screening assessment also. We do a psychological screening also at the time of admission, which is basically to have the interaction with the team of psychiatry and psychology. So whenever they have a difficulty, we give a message that you have a problem, you please come to us. It's a kind of building a relationship with them. So if any college can do it, it's not the purpose of screening. More so, the purpose is to develop that relationship so that they feel free to come to us anytime, to have that rapport with them. So, but yes, I will tell you, in recent time, the numbers have increased, the problems have increased, and they do have a problem. So it is an important issue. Any other question or?
So there is one more question. Please comment on the role of mentors for doctors and PG students.
Okay, that's a very important point. I think Dr. Sood, what he said, that what is the role of mentor? I think personally, I think mentors play a major role. What happens in many places they do, the list is there, but actually it is not continuing. And because of many reasons, sometimes students, they feel hesitant to come to consultant. Sometimes there are barriers to come to consultant, and they feel that they will be identified, they will but the important thing is what I can say, that and this is what we did at AIIMS. I can tell you AIIMS model, which I was part of about 20 years ago, where each department there were two resource persons were identified. So instead of sending all to psychiatry department, each department, let's say the pediatrics department, so you can have the two resource person which can be trained in a workshop, which we did a workshop. So the resident is more comfortable to talk within their own department rather than going to so one can identify resource person, and if they can talk, so I would say 50-60% problem can be handled at that level itself. Of course, if there is a more problem, then that can be handled by the consultant of that department can talk to psychiatry department, and that can be easily managed in that way. So mentors do have a role, very important role, if it is followed up seriously, and it can really make students benefited by that. But many places actually it is not following up. Initial enthusiasm is there, then later it's not there. So but what can be there? Because what happens, but sometimes these students, they have multiple roles. They do get stressed at times. So some support is required. So the mentors have a major role to play in that. Any other
Good
question?
afternoon, sir.
Very good afternoon.
Thank you, sir. It was such a wonderful presentation. And
Thank you.
I really, I'm really very concerned about the stress among the medical students and doctors. And I think, you said you have organized communication skill classes for the students. I think some, you also talked about, they should talk about self-gratification. They should develop all those organization skills and all that. And if it can be incorporated in the curriculum, maybe half an hour in the training, and that will be, I think, that will go a long way for developing positive emotions among the students, and positive, that will really prevent them developing all this stress. They will learn a lot of life skills to handle all these difficult situations. I was just thinking, I'll just speak up on this and to think about for the organization, if that is possible.
Thank you. Thank you so much, Dr. Rita Raseli. I think you made a very important point, because what we feel that communication at times is a very important source of stress at times, and which can be managed. Most of the time we feel incompetent to communicate, and yes, and we need to pay attention. Even now we know that NMC also has made a draft of this, and this I'm talking of 20 years ago at AIIMS we did that, and it was very beneficial to many students. So we all know that the communication skill can be learned. People think it's born, so one cannot learn it. But what we believe, and there is evidence that it can be learned, and it does play an important role. And the most important is your own self. I think, yes, you are right. And that is why we always pay more attention to the self-help and self-help management and so on. So I think that is very important in any kind of adversity, in difficult situation. What is important is how you can help yourself. I think that becomes an important issue. Yes, I agree with you.
Sir, there is one
Thank
more
you, sir.
question. How to deal with the feeling of unnecessary guilt? Yes.
Yeah, yes, that's an important question. Unnecessary guilt. I think first you have to see, you go back to my own, what I said. You first try to analyze yourself on what basis you are having a guilt. Guilt can have sometimes, because you are in low mood, you can have, if you are in a stressful situation, or if you have done something which you didn't want to do it. So first try to see that what is the source of this guilt which is coming, your own personality, so the best is talk to yourself, analyze yourself, and make a plan that how you have to overcome it, and make a strategy, that one that, in future, if suppose you have reprimanded someone or punished someone, then later you have a guilt. So see that so if it is there, then you just have to, say to yourself that I will help in this way, that I will help myself, because these are all emotional things. So helping yourself, again, self management skills. Maybe if you are too stressful or anxious, so you can have breathing exercises and other techniques can be employed to take care of that. But the important thing would be to looking at the source of this guilt.
Dr. Aditi Mohta, raise.
Yes, Dr. Aditi.
Sir, I was the one who asked at 3:52 p.m. I was requesting for a few self-help recommendations, if there are any resources available online or any books.
Yes. What I will do, self-help. In fact, my last two slides, actually, the table which was there, which we have taken, and that gives all the points and how to assess yourself. I can share with you that. I can send you. You can tell any of us. I can send you that. There are many, in fact. Self-help. We have made a document in ICMR also when the COVID phase. There it is available. We can provide you that.
I'll
In fact, my
communicate with Dr. Jaswant,
last two
sir.
slides were on that only.
Okay, sir. Thank you.
Sir, there is a question. Sir, there is a
Yes,
question
please.
for you.
Yes, please.
How to...
This already I have
Okay,
answered.
you're done.
Yeah.
Okay.
Unnecessary.
I have feeling of committing suicide. What should I do?
Okay, I think that's a very important point, and this is what is, and sometimes we do face that if there is a feeling of suicide, then of course this could be related to mental health issues, depression, anxiety, or any psychiatric condition, or even if it is not there also, it's not necessary that it can be impulsive also. If this is there, the most important thing is for any such thought is that one needs to communicate about it. That if it one should, that is what pact we do in our clinic also. If it comes to you, then you will tell us about it. That is what the pact is. So one needs to share about it and see that what is the help available. And in fact, when we talk of psychological first aid, there are models for suicidal thoughts also. So again, the important thing is that to know yourself, to be aware of about these thoughts, that these are there, and you can label that, okay, these thoughts are coming to me. Then you will share with the immediate family member, to anyone who is around you. Then they will talk to you. At the same time, you need not stay alone. Be with someone, have a support around you, and also as early as possible you can take a professional help, if and not to be taken lightly, and it need to not be dismissed as such. So the important thing is to take help as early as possible. Now in the same, so this you have said, when you yourself have these thoughts, so this is what steps you can follow, 5 steps. Now the situation may come that suppose you are in office, hospital, or some your friend is having these. So what you as a friend have to do it. So the important thing what I said is psychological first aid. You just have to follow that. Look, listen, and link. So you just have to look at that. If you see my first bullet in that was to put a full safety of a person. So that full safety is that there are no sharp objects around person. So just see that all the precautions are taken, because these are some of the preventive measures which have to be taken, and person is not alone. So that's a look part. The listen part is just talking to a person, interacting to a person, discussing about a person. Okay, what is happening, how we can help you, how we can support you. Then the third part is a linking part, that you link to a professional or link to a hospital or link to any place. So these all need to be done. And the most important thing is that that person need not be alone. And someone need to be around in a batches or whatever way, and see that as early as possible the help, professional help, is provided to that person. So I have answered your point. If a self has a problem or even others have a problem, so these are the steps to be followed when one is having these thoughts.
So there is another question which talks about how do I find my colleague is under stress?
Yeah. As my presentation, if you see, have the stress, there were no 6 set of symptoms I have provided: physical, emotional, cognitive, autonomic, social. So these were the symptoms of stress. If they are there, then you can say that your friend is in problem. Let's say your friend has become irritable, or your friend is having mood swings, or friend is just confined to his hostel or no room, not going out, or or he's making a lot of mistakes. Your boss will tell you, your senior will tell you, आप बहुत गलतियां कर रहे हो. तो ये change in behavior अगर लग रहा है, तो I think that is a very important way of identifying that you are in stress. So if it is there, then of course you then what I said, being aware, analyze, and apply. You just have to do it in that order. I think one can easily help oneself once you are aware of these situations.
Sir, there is another question which has been asked, sir. They have written, yes, sir. They have written that, sir, many times regarding procrastination that they have written. Thank you for the wonderful presentation. My question is how to overcome inertia and procrastination when trying to follow the techniques advised. Sometimes there is a lack of energy after doing a lot of work and personal issues, and we are aware about the techniques, but we keep procrastinating. So they asked how
That's
to
a
overcome
very,
inertia and
yeah.
Sir.
Yeah. In fact, procrastination was one of my bullet was there, and that is an important point, and which I mentioned in the time management also. It may be a symptom of stress at times, and if procrastination is there, one has to see what is the basis, why it's happening. One has to ask oneself, and one important thing is sometimes the confidence level is low. You don't want to start at any activity now. You want to postpone it. So because you are not sure of the situation. Sometimes a person may be, what we call as a very, very, what we obsessive nature. So they want, I will only start when everything is perfect. When a very person is very perfect. So procrastination is one of the feature for obsession also. So one has to see what's the reason behind that, or one is anxious or obsession or whatever. So based on that, you have to have the remedy for that, like something like positive emotion, increase your confidence, or even self gratification, which we mentioned. So all these can be applied. And if it is along with other symptom, then one can seek help, in the sense that not to a professional, but also you can discuss, talk. So what can be done? It is your own motivation level, actually. So maybe that you are not motivated to start anything, you want to delay it. So that has to be taken care of. That the cause has to be fixed up. If it is the obsession, then you have to fix that part. And sometimes there may be low confidence also. That also has to be fixed up. So self-talk, self-gratification. So these are all related to self. So I think, but if you know your limits, then you can take help of your friend or family member also.
Right, sir. Thank you, sir. Sir, another question that has been asked is from Dr. Partha Ray. Should we encourage doctor, student, and faculty to take up group hobbies that will increase bonding among colleagues and promote trust and well-being among doctors. So competitiveness among doctors give rise to collaborativeness, and I have seen lawyers doing it all the times. Doctor don't and likely put each other down solutions. So what are the solutions for it?
I think this is a good solution if all can work collectively interactions. I think that is why in some department I know they have a group activities, hobbies and all. I think with a common interest, interactions and all, that is really beneficial. I can tell you because something I will tell you what I used to do. Anyway, Dr. Jaswant is also alumnus of our department. Sometimes, and I am sure many of the other my colleagues are doing it. Suppose you have interacted, a person is very stressful. So I just take that person out and have a coffee together and just chat and just discuss and talk to a person. It is very beneficial at times. Just open out and so anyone can do it. You just have take out in your office or out of office and having a coffee together. I'm not saying that you go to picnic, but of course, some as a group activity they do. But just doing some activity out of your routine, and that is what is time off, and that is what which helps to reduce your stress. Take a time off. Just interacting on one-to-one basis will be helpful, and that will improve the student and teacher interaction also, relationship also.
Sir. Thank you, sir. Sir, do we have time to ask more questions? Because still there are many questions which are pending. So we can take up the
Fine.
questions as per
So
the
what you
available
can
time.
do, because here the list is not there, Dr. Jaswant, so you can chunk it them
Okay,
and
sir.
maybe I can respond.
Right.
There may be some questions which are common. So maybe that's
Right,
what we
sir.
do. So that instead of repeating the same thing again and again. Yeah.
Right, sir. So there is one general question which has been asked by Dr. Manas Kalita: how to change the surrounding environment which is responsible for causing stress?
Okay, no, my answer is very simple. Things you cannot change, don't do anything because you can't do anything. So how you can change a surrounding, because that is not in your control. अगर building का structure है, आप उसको तो नहीं बदल सकते. You have to change yourself. देखिए, कुछ चीजें life में you should be very clear. That is what my last slide was. Things you can change, you can do it. अगर अपने आप को change करना है, you can do it. But things you cannot change, you have to accept it. जो जैसी है, you have to accept it. If your teacher, your boss is like that, so you have to accept it. You can't change him or her. So you'll have to see how you can change yourself, or you have to change your perception then. It's like this. We can't change everything around us. That also needs to be very clear.
So another query that has been put that regarding English language communication. So the English language communication is a stressor for many doctors and students who do not have a good hold on English. Would it help if we speak among each other in mother tongue and vernacular? Please suggest. So
Yeah, I think that is what actually I can tell you. North India, we do talk in Hindi language. The local language is being used because that's a language we use for a patient care also. That's how it is. But we know that our textbooks are in English language, and so it's a balance. So you need a local language as well, and you need an English language to understand some of the techniques, skills, and all. So, but I will tell you the remedy is. I will tell you my example I can give you as I did my MD from NIMHANS Bangalore. So when we were there, I was from North India. So there was, in fact, there is one consultant, Dr. C.R. Chandrasekhar, who has recently been awarded Padma Shri. So he used to take our Kannada classes. He was there who was taking a Kannada classes for us. And we became almost proficient, and he used to take regular classes. So the same thing can be done. So the English classes, if can be taught, something can be done to support them, because all fingers are not same. There are some who are good, some who are not good. So you have to support them. and that the responsibility lies with the medical college or institute. So if there is some difficulty, then we'll have to support them.
Right. Thank you, sir. Sir, another question also, do we have a doctor's support group who can be contacted on an emergency helpline to have solutions to lives and professional crisis of doctors themselves?
I think you know it better. RDA के आप president रह चुके हो, तो I think so. Of course, every place has a RDA student association and group is there. I think, and what message I can give is that don't be afraid, or if you have any problem, that is what one of my important slide and message I gave. The way you take care of physical health, same way you take care of emotional health also. So don't afraid or to visit a psychiatry department or sometime. I know there is a change now, and many people they come just straight away and talk and discuss. Things have changed now. It's a positive change, but still we should not hesitate. If there is a problem, always I say you just have to raise your hand. There are people who will lift you up, who will take care of you. You just have to say that you are in problem. And sometimes there are many around us who gives advice also. So but at times it's too many also. So you know that who is the person to whom I should go and visit. So that also instead of group, sometimes one-to-one interaction may be more helpful instead of a group. Group में क्या होता है, things get lost. So rather what I have personally seen, that the real benefit comes when you have one-to-one interaction rather than a group.
Right, sir. Another question, sir, just posted. What would you say to a student who wants to leave medicine as it's too stressful and shift to something else? Would that be supported and the person not feel like a failure? Please suggest, as this is a sensitive area of counseling a student.
I think yes, this is a sensitive area. In fact, that is what I gave a data. More than 1,000 students have left, dropped out from the medical college. In fact, it was a revelation for me also. I know that there are some, but I never knew that the number is so huge. Yes, I think if it is too stressful, then it's better to think about it. I know a lot of pressure is there from the family and all. It has to be discussed with the family and what are the alternatives, what you want to do, what so that has to be discussed. And leaving again does not mean that you are weak in any way. You may be good in something, you may not be good in other thing. That's what I feel like a balance. Always I tell my young people, हो सकता है आप पढ़ाई में अच्छे ना हो, बट हो सकता है बाकी चीजों में अच्छे हो. And it happens. Life is like a ecosystem. And we have seen that, and we all know, in fact, wonderful, lead program was there here itself in this room in NAMS, and we know that cognitive intelligence is just one part of it. There are other types of intelligence, emotional intelligence, social intelligence, actually that play a major role for your success rather than your cognitive intelligence. So हो सकता है कि you may be good in some other things. But that call has to be taken by the family, and it's a collective call, so.
So thank you, sir. It was really very, very informative and hello. Yeah. So
Yes,
it was
yes.
really very
Go ahead.
informative and very insightful session. That within first 2 minutes, we reached the maximum limit of 100. And I was getting many messages and calls. We are unable to join at it. It has already reached its limit. So we sent them the YouTube link, and many people they attended through YouTube. So I think it was heard by over 2,000 participants because from AIIMS Devgar itself there were more than 100 participants at AIIMS Devgar only from a single ID. So thank you, sir. Thank you very much again. So I think now we can now we can close the session. So we can I would like to now yes, sir.
No, but for this, I think you should thank, Dr. Umesh Kapil and Dr. Sood. I think he was the one who was instrumental in this. So because he just wanted that I should come. So actually he has to be more thankful than what I am. Just a mediator. So I am so. But I must thank all the enthusiasm, all the messages I am going through. It's a wonderful. I think I have not seen this kind of enthusiasm. I think let me compliment NAMS and Dr. Sareen and everyone. And I feel sometime what has happened over the time, I was getting a bit low on the online because online was too much in the COVID time. But this has given me enthusiasm now. The kind of enthusiasm people have, that's wonderful. I think that gives opportunity that we can interact and have such type of more discussion and lively interaction. That's wonderful. I think I am feeling elite. In fact, my stress has gone completely after this.
Higher stress.
Yes, back to yes, Jaswant. You want to say something?
No, sir. Thank you, sir. Thank you for such an interactive session. It was really good to see lot of interactions, and I do agree completely with you that in last 2 years, like this is one of the most interactive session online that I have witnessed. So again, definitely, sir. Big thanks to Professor Umesh Kapil sir and Professor A.K. Sood sir and Dr. Sarin. Definitely, he is the boss. So with this, I think, sir, I would like to invite Professor A.K. Sood for the vote of thanks. Over to you, Sood sir.
Okay, thank you so much. On behalf of the National Academy of Medical Sciences, it is indeed my great privilege to thank the distinguished speaker for this evening, Professor Rajesh Sagar sir. He has covered a very important topic and given the practical tips and hints. The way he has explained with metaphors and example, I think all of us have benefited. So thank you once again, sir, for being with us and sharing your valuable experience with all the participants. We are really grateful to you, and we look forward for your support in future also. I will also like to thank all the participants, faculty members, as well as the PG students who have been in this with us this evening and made this session very, very interactive by asking questions. So special thanks to all the director, deans, and senior faculty of AIIMS and all the medical colleges who have been supporting this program. And with their support and help, we have more than 1,000 students who have registered with us, and we really appreciate their efforts. And we look forward that this support will continue. Special thanks to Director AIIMS Deoghar, Dr. Vashne sir, who has made special arrangement for all the PG students to attend this session. So we really appreciate this session, and we hope that other medical institutions will also ensure that in future their PG students attend these sessions. And in these sessions, we are covering the topics which are of common interest across the specialty. So all the PG students are going to be benefited. And once again, we invite the faculty members to come forward and participate in the session. And the students, we request them to suggest the topics which are of common interest and which they think should be covered during this session. So once again, I thank all of you, and special thanks to Dr. Jaswant, who have been helping us from the very beginning in moderating this session. On behalf of the National Academy, we are grateful to you. Here at the Academy, Mr. Ravi and Dr. Neha has helped us in organizing this session. Mr. Ravi has been writing emails and informing about the details of the program. So once again, we place on record their efforts. So before we conclude, once again, I thank you all for being with us. Thank you, sir. Over to you, Dr. Jaswant.
Thank you, sir. Thank you, sir. Thank you, Sarin sir, Professor Umesh Kapil sir, and Sood sir for providing me the opportunity to moderate the session. And thank you very much. So I think with this, we can mark the closure of this session. And as Professor Kapil, he assured that recording will be provided of the session, because many students were asking regarding the PPTs or the recording of this session. So thank you, sir. I think we can mark the closure. Yeah.
Thank you.
Thank you so much, everyone.
Thank you,
Thank you. Thank you for this enthusiasm and this overwhelming response. Thank you.
Ravi.
Thank you.